Public Service and Administration Minister Inkosi Mzamo Buthelezi has told the Government Employees Medical Scheme Symposium currently underway in Cape Town that the NHI is about addressing the root causes of the challenges facing South Africa's health system holistically. The minister also added that the NHI is about bridging the gap between public and the private healthcare system. For more on this, we cross to SABC News reporter Lulama Matya, who is attending the symposium for us. A very good afternoon to you, Lulama. So, of course, we spoke to you earlier, and no doubt you've been speaking to a lot of people there on the ground. What are people saying, and what's been discussed around the NHI?
Welcome back to the Cape Town. We are here at the Century City Conference Center, Nompu, where the annual GEMS Symposium is currently underway. Well, GEMS has beneficiaries or members of more than 2.3 million. They are meeting this year discussing health matters. We know that the country currently has two systems of healthcare. We talk about private healthcare, we talk about public healthcare, but going forward, government is moving for a universal health care. Hence, we're talking about the NHI, which was signed by President Cyril Ramaphosa before the 7th administration. But to talk to us more about matters around the symposium, Nompo, I am joined by Masingita Chavalala, who is an executive manager at GEMS. Ma'am, when we talk about access, prevention and promotion, with more than 2.3 million beneficiaries, how does GEMS make sure that all those matters are accessible by beneficiaries?
One of the things that GEM does very, very well is understanding what we call the South African family. What this means for us is that family does not necessarily only focus on your immediate family. We are able to extend benefits and membership towards extended family members. So you can enroll your stepchildren, you can enroll your grandparents, your great-grandchildren. So that's one of the things that we talk about when we talk about access, making sure that those that have previously not been insured are able to be insured. From a benefit design perspective, one of the things that we do is to try and understand the member experience on the ground, so that when we do our annual benefit design, we focus on areas where we see gaps in terms of access. So when we revise our benefits, we note the fact that if members are experiencing certain challenges in specific benefits in specific areas, we consider that as part of our strategy, considering how wide does the problem go and to what extent we can be able to extend those benefits as part of our benefit design processes, using data analytics and our actuarial analysis processes. From a promotion perspective, we look at making sure that we communicate the benefits that members have. One of the challenges that we find is that as much as we can have comprehensive benefits, sometimes the understanding and the appreciation of the benefits that members have doesn't always translate. So we have a lot of promotional campaigns just to make sure that the member on the ground understand what is available to them and what it is that they can utilize to be able to ensure that they continuously manage their health care. From a preventative perspective, we've got wellness screening services, we've got vaccination. What we see is that there has been an uptake on preventative care initiatives. However, we do still find a challenge in terms of ensuring that there is a broader understanding, which also brings it back to us in terms of simplifying the way that we communicate the benefits, so that members understand on the ground what it really means. Sometimes we just don't know what we don't know. And from a GEMS perspective, I believe that GEMS is a good story to tell. We are able to provide all of these services and all of this benefit to our members. It is our responsibility now to make sure that our members understand in detail the benefits that they have and the benefits of issues like preventative health care to be able to avoid long-term diseases.
Let's talk about access. South Africa has high rate of unemployment, and many beneficiaries, I would assume that they have lots of dependents on them. What are your age restrictions on when it comes to dependence on the scheme?
So as a principal member, you are able to motivate, especially with children. Sometimes you find, especially with young children, you get children that go to school, they study, but ultimately, like you're saying, high unemployment rate, it is difficult to find work. So you are given an option to motivate if that person is still under your care, for you to annually motivate that person is still under your care, and GEMS will be able to cover that member. So that's how GEMS goes that extra mile in understanding some of the challenges that we face, like you're talking about in terms of unemployment, just to make sure that we still provide the access to beneficiaries. And
to your people that have exited the systems, those who are not who are pensioners, what is happening? How long are they? Do you keep them in the system? What happens when you're pension?
So when you're on pension, there is a pensioner rate that you pay. So GEMS does cover pensioners. Again, it can cover pensioners through a pensioner joining as a principal member, or if they've got a family that's within the GEMS membership already, they are able to be also enrolled via a principal member that is already in the GEMS space. That's what I meant by the South African family. We have that appreciation of a broader context of the South African family. So we do have pensioner benefits.
Thank you very much, ma'am, for your time. Nompu, let's leave it at that. She's talking about GEMS being a South African family.